Hi everyone, my name is Kate, and one question I get asked frequently by clients is, what is gluten and should I eat it or should I consider adopting a gluten-free diet? So gluten, according to Leonard and Vasagar in 2014, is a protein in cereals, so wheat, rye, barley. It helps dough rise. It holds food together while maintaining a palatable texture. According to Mocan and Dumitrascu in 2016, gluten is composed of two proteins, gliadin and glutenins. Gliadins are the more toxic because they can't be degraded by intestinal enzymes in certain individuals, and in other individuals they trigger immune reactions. Leonard and Vasagar in 2014 noted that there are a few hundred gliadin proteins, each with its own unique toxicity profile. It's also assumed that older varieties of wheat may be better tolerated by gluten-sensitive individuals than the newer strains. And it's estimated that wheat contributes to about 50% of calories consumed by individuals in industrial or developed countries. So it's pretty important for someone who consumes this kind of diet to understand if they are gluten sensitive or not. Three conditions arise when in situations of gluten intolerance or sensitivity: celiac disease, non-celiac gluten sensitivity, and wheat allergy. The presence of two genes, HLA-DQ2 or HLA-DQ8, put an individual at risk for gluten sensitivity. This is according to Leonard and Vasagar in 2014. So just because someone has one of these genes doesn't mean they are gluten sensitive. It just means that they're predisposed for the condition. So it may develop over the course of their lifetime. It may not. Celiac disease is an immune-mediated enteropathic response to the ingestion of gluten. Classic symptoms of celiac disease, according to Mocan and Dumitrascu in 2016, are abnormalities in small intestinal mucosa, so intraepithelial lymphocytes, critic hyperplasia, and villus atrophy are likely to occur. Some GI symptoms commonly occur, such as diarrhea, malnutrition, weight loss, edema, steatorrhea, abdominal pain, acid reflux, distension, bloating, vomiting. Not super fun. Of interest to me are the extraintestinal manifestations of celiac disease, so places outside the intestines where symptoms can arise. So these are iron deficiency. So when the villi of the intestines atrophy, which means they can't absorb nutrients as well, we don't get proper iron or enough iron from our diets. Our body can't absorb it. So you get things like iron deficiency, anemia. You can't get the proper amounts of calcium. So some people have osteopenia or osteoporosis, peripheral neuropathy, infertility. Infertility could come from a zinc deficiency, so body's not absorbing enough zinc from the diet, abnormal liver chemistry, depression, and vitamin and mineral deficiencies. In the skin, celiac disease manifests as dermatitis herpetiformis, which is a skin rash that occurs after gluten ingestion. Basically itchy blisters on the elbows, knees, butt, scalp. Not fun. Some diseases also co-occur with celiac disease, such as thyroiditis, type 1 diabetes, inflammatory bowel disease, systemic lupus, Addison's disease, multiple sclerosis, and neuromyelitis optica. Contrasting with celiac disease is non-celiac gluten sensitivity. This is also an immune-mediated disease, but unlike celiac disease, which activates an adaptive immune response, this non-celiac gluten sensitivity activates an innate immune response. So different immune systems. It doesn't have the same serology profile. So in celiac disease, patients often present with high levels of transglutaminase 2 antibodies in their bloodstream. Not so much in non-celiac gluten sensitivity. You don't have that same degradation of the intestinal mucosa. You do have similar symptoms in the GI tract: abdominal pain, bloating, diarrhea, constipation, and some extraintestinal manifestations of non-celiac gluten sensitivity. So foggy mind, fatigue, joint pain, paresthesia, rash, and depression. Of interest to me is that celiac disease and non-celiac gluten sensitivity seem to be more prevalent in women than men. So the female to male ratio of celiac disease is 2 to 1, so 2 women per 1 male, and non-celiac gluten sensitivity is more than 3 women per 1 man. So that just may mean that more women are being diagnosed, or it may affect women more. So that's something to be interested in. As far as onset goes, celiac disease can onset at any age. So you can live half your life and not be gluten sensitive, and then, all of a sudden in your 50s you can become gluten sensitive. Whereas non-celiac gluten sensitivity is more likely to onset as an adult. So the third disease that arrives from a gluten sensitivity is a wheat allergy. And this is similar to the type of allergic reaction someone may have to, say, peanuts. So it's an immune reaction to wheat. And wheat is actually the 8th most common food allergy in the United States. It can cause urticaria, bronchial obstructions, nausea, and gastrointestinal complaints in children. And in adults, it presents as classic food allergy symptoms. This is also according to Leonard and Vasagar in 2014. So what should you do if you think you may have a gluten sensitivity? Well, the first step is you should try a gluten-free diet over the course of a month or 2 months to see if it makes you feel better. With any dietary change, I would suggest doing this under the guidance of a certified nutritionist, dietitian, or doctor. Someone who can make sure you're doing it safely and in a way that gets you more accurate results. A lot of people don't know all the places gluten can hide in your diet, so that may skew your results if you don't do it properly. So make sure you do this under the guidance of someone who is certified or licensed and knows what they're doing. So that gluten-free diet can help see if you feel better. You can also try to reintroduce gluten after a month or 2 of leading a gluten-free lifestyle to see if it causes symptoms to return. That's a pretty surefire way to see if gluten's causing some problems. The other way you can go about this in determining if you're sensitive to gluten is to talk to your primary care physician to order a blood test to check for levels of transglutaminase 2 antibodies or deamidated gliadin peptides, which both elevate in the face of celiac disease. Or you can perform a biopsy of the small intestines, which also shows if you have any abnormalities in the small intestine mucosa. Those are all great ways to figure out if you may have a gluten sensitivity that you were unaware of. Anyway, I hope this helped. If you do have any questions, please let me know. Thank you.